In OET Speaking, you are evaluated on your ability to engage in a conversation with a patient. In this kind of interactive communication, there are three main skills that you should keep in mind when preparing for the exam: turn taking, initiating the interaction appropriately, and responding appropriately to the patient at the required speed and correct rhythm. It's worth noting down three main principles for turn taking. 1. Only one person should speak at a time. 2. The transitions from you to the patient should be smooth and there shouldn't be any gap or an overlap. If there is an overlap, give way to the patient to speak. And 3. Make sure that any silence or any pause, it shouldn't feel uncomfortable. And if it feels uncomfortable or unnatural, then you should tend to fill it in as quickly as possible. Similarly, learn how to respond appropriately. Learn the difference of when it would be appropriate to use a verbal response or when you can use filler words appropriately to encourage the patient to talk more. This is because if you take a verbal response, it can be interpreted as an attempt for you to take a turn to speak. Some examples that you can use are, I see, go on, alright. So these are some examples that you can use as minimal responses, and these indicate that you're actively listening to the patient and you're taking an interest and you want them to keep talking more.